your screens as well. Yep.
Yes.
Okay, excellent. All right, so I'm presuming you can see the shared screen now?
Yep. Yes.
Awesome. All right, let's get into it. So hello, everybody, and thank you for tuning in to this recording as we give you a quick summary of the continuous improvement for commissioning process that we are in the middle of and the release of the second commissioning listening report and action plan for 2023-2024. My name is Fiona May and I lead the commissioning team within the Community Services Directorate. And before we begin, I'd like to acknowledge that we are making this recording on Ngunnawal country and pay my respects to the Ngunnawal people, their elders past and present, and to other Aboriginal and Torres Strait Islander people who have a long and enduring connection with this beautiful country that we are privileged to live, work and play upon. So joining me through this presentation will be Jamie Droney, who leads the commissioning team in the ACT Health Directorate, and Devon Bowles, the Chief Executive Officer of the ACT Council for Social Services. This presentation supports the release of the second commissioning listening report and improvement action plan, which you can find available on the commissioning website. Together, the CSD Directorate, Health and ACTCOSS have worked really collaboratively over many months in a really close partnership to develop practical actions to address the challenges and continuously improve commissioning practice and experiences. So we're now entering the fourth year of the Human Services System reform and of commissioning. Before we dive into the detail of the listening report, it's useful to reflect for a moment on where we're at. Our partnership looks and feels like this. There is some anxiety, there's a lot of work going on, there's some frustration, and there are genuine efforts to streamline commissioning. There are questions about how commissioning has or will influence funding, and there are only a few examples of this so far. There are challenges, and we knew that there would be, that we need to meet, including for things like transitions. So there's a great deal going on and it is a complex space that we're working in. This isn't a new slide and it is just representational. The x-axis broadly scopes the larger commissioning processes to the right, while the y-axis scopes programs by how targeted their impact is or the population group that they may be designed for. So we're showing it to you today to represent where the commissioning processes are at in the commissioning cycle. You can see the subsectors that are progressing with the investment processes, either through new agreements in purple or through pilots in blue, where they're looking to gather evidence before further commissioning happens. In grey, you can see the subsectors that are already in the delivery phase post their initial commissioning work. In orange are the subsectors where extensions are being sorted to allow more time for commissioning. And in pink are the ACO commissioning cycles, and those commissioners are working really closely together to align their engagements with that sector. When we sought feedback that informed this listening report in the middle of 2023, this diagram would have looked a little different as most of the cycles hadn't progressed to the investment phase. Jamie.
Thank you, Fiona. Let's take a look at how we gathered data for the listening report. As you're no doubt aware, we seek feedback regularly to drive continuous improvement, and we drew on multiple sources of data to inform this listening report. Between April and June 2023, both the sector and government shared their experiences of commissioning through an annual survey. We received 85 survey responses in total, 41 from government and 41 from non-government respondents, and 3 respondents who chose to not disclose. We also provide the sector with opportunities to provide feedback on specific commissioning engagements through our post-activity surveys. Survey responses collected between January and June of 2023, there were 323 of these in total. They're also captured in the report. The strategic commissioning teams and ACTCOSS have also facilitated or participated in 238 formal and informal engagements between June 2022 and June 2023, And these engagements include things like one-on-one discussions, correspondence, involvement in various working groups, commissioner support mechanisms, sector update forums, and lived experience meetings. So 238 unique and valuable inputs from those engagements have been reflected in the listening report. Synthesis and analysis of the data, as well as the development of the report itself, was very much a collaborative effort between government and ACTCOSS. In essence, we reviewed and analysed all the raw benchmark data. We used statistical techniques to analyse the data, and we've depicted those key findings in standalone and in comparison graphs. We read through all the narrative comments that were captured, and we reflected on the insights and drew out the key themes which emerged across all of the sources of data. Given that some time had already elapsed between the end of the data collection period and the development of the report, we also identified what we had already implemented to strengthen the experience of commissioning. And together, we workshopped what further actions might be required to address some of the identified challenges. We also shared and discussed the preliminary insights and actions with sector peaks and with the commissioning senior officials group. And from that, we agreed on a number of priority actions to make sure that they would have the greatest impact on future commissioning activities. So to sum this all up, the listening report is robust and comprehensive in nature. The collaboration between Health and CSD and ACTCOSS was pivotal to the quality and the credibility of the report. We do acknowledge that it has taken time to get the report published, but we were keen to get it right. And the collaboration did take time, but it was incredibly valuable because it meant that we were each able to bring our different perspectives on the data. And by the end of the process, we had a very good appreciation of the challenges and opportunities that the process had given us all.
Thanks, Jamie. I really want to second the importance of this partnership. The whole idea of commissioning is based on partnership, and it was therefore important that this listening report modeled that. And I think we did collectively a really good job, and I'm grateful to government for the extent to which they've taken on board our feedback. One of the challenges of a joint report means that recommendations, need to be sort of signed off by all parties. And for recommendations that require expenditure, this report is not the mechanism to get approval for that within government. So we recognize that there were some recommendations that ACTCOSS would have made, but which government, because of how budget processes work, could not commit to in this sort of a report. So I think this report really gets the diagnosis right in terms of understanding what the strengths and areas for improvement are for commissioning, but the prescription is only partial. So we know that for many conditions, you need Panadol to relieve the pain, but often you need something else as well. And so this report, has that first level of prescription, but not some of the more tailored, targeted ones that require funding that we would have liked. We have, however, started to see some real changes in how commissioning cycles are being developed. And the challenge will be to ensure going forward that capability priorities are funded and enacted. Thank you.
Thanks so much, Devon, and I did enjoy your medical analogy there. So we knew that this reform would take at least 10 years. In fact, I'm starting to think that now that we're 4 years in, it's probably well more than 10 years that we really need to genuinely make significant change to the human service system. We agreed a way to continuously improve as we implemented commissioning, and some of you may recall being part of a working group that established our initial commissioning evaluation plan back in 2021. It's really important to acknowledge that our listening and improvement is not ad hoc. It is genuinely planned and considered. It may not feel like it's enough to manage the disruption that change brings, but how we evolve is a considered part of a reform which is being delivered over such a long period of time, and it really needs to be. If we keep patching and tweaking based on anecdotes or individual opinions, we would get further and further away from the intended approach of working together through commissioning. We need to be considered and we need to do this together. And that's why the feedback and improvements are for both government and the sector. We do hear lots of anecdotes about challenges and frustrations, but we have ways of listening and gathering input and taking action, and we can only work with what we have. We have seen a shift to lower participation rates in the formal feedback mechanisms. We saw a drop from 195 NGO surveys in 2022 to just 40 in 2023, and a similar drop in how many government responses we received. While we had much more input from the post-activity surveys, this too was patchy, with some commissioning cycles gathering ongoing feedback whilst others didn't. There are, of course, other ways that we hear about what is and isn't working, including through those processes Jamie was mentioning a moment ago. But it is through these formal processes, like the data analysis that underpins this report, that we can plan what needs to change and improve. I know it's tedious when we ask you to provide your suggested improvements or challenges through the formal feedback processes, but we've got a good reason for doing that. It means we can transparently learn from what is going on, and we have solid evidence that underpins changes that are proposed to government.
Thank you, Fiona. This is a complex slide. I won't try and read through it for you. I'll try and just speak around it. It's talking about what we've been doing. So it is really important to recognise that we haven't been waiting for the listening report before implementing process improvements. Across government, we've been listening and taking note of what the sector is telling us. We've been consistently reflecting on our approaches and subsequently refining our process as part of a try, test, learn approach. When we started this reform, we recognised that there would be things we would need to address, and we agreed with the sector that we would take commissioning we would tackle commissioning complexity together. We've made the shift from commissioning as a concept into commissioning as a practice, and we note that this has certainly been tough at times and not without its challenges. But it has been pleasing to hear that some of the benefits and impacts of the process improvements that we have already put in place are being felt at the sector level, and we're motivated to keep building on these small wins over the next year and beyond. Some of the more notable examples of process improvements that we've already come up with include better planning and facilitation of commissioning cycles and engagements. In some instances, we've drawn on the expertise of experienced external facilitators. In the ACT Health Directorate, we've been piloting the use of project management methodology and software to track the investment phase activities and milestones. We're consistently exploring opportunities to better integrate cycles. We've created more resources for lived experience, including developing a lived experience guide and convening the lived experience panel. We've developed clearer advice, process checklists and templates for each commissioning phase, and these are being periodically refined based on experience. We've improved communication through more regular website updates, emails, and more relevant topics covered in our sector updates. We know and recognise how critical communication is to preserve relationships with the sector and to sustain our credibility and engagement in the commissioning reform. And we're always striving to strengthen our communication, and we'll continue to do so over the next year. I think we're now better prepared to support transitions of service which take place through commissioning. This has been a really significant body of work, and it's culminated in the development of the ACT Human Service System Transition Policy, as well as the development of tools and templates to support the practical elements of transitions. And we're piloting these tools and templates as we go through the current tranche of commissioning cycles.
Jamie.
I do beg your pardon. I didn't see the slide change. My bad. So yes, enough about how we got to where we are. Let's summarise what we have heard from the listening report. So we're going to spend some time now going through what we've heard and the experience from both government and non-government sector respondents. Now, if you have participated in any of the surveys, you'll know that there is an evaluation framework which identified the 5 broad areas that we've been monitoring, and those are the 5 broad areas on this slide. Each of these broad areas is an important foundation for commissioning to be successful. If any of them is missing, so if we have low trust, or if our relationships are poor, or if we're not optimistic the commissioning will make a difference in the lives of people in our community, or if we don't have a collaborative approach, or if we don't spend the time we need to collaborate, then commissioning is less likely to achieve the aims of the human services reform that we agreed with the sector back in 2021. So to sum up that slide very quickly, there are 5 key elements and we need to keep our eyes on those at all times.
So that's what we did with this report. We've organised the report around those 5 key elements that were identified in our commissioning evaluation plan back in 2021. And when you go to the report, this is the kind of thing that you'll see. We cover each of those themes and we're able to compare the data from this round of evaluation with the previous year. So from the 2023 quantitative annual survey data, 20% of people had high to very high trust that commissioning principles were being upheld, while 30% had a neutral response. And we can see that there's a shift when we compare those responses with the baseline data from the previous year. But what does that tell us? From the people that responded, both how they scored and the comments that they made, we can hear a few different things. We hear that poor communication by government is impacting trust in the commissioning process and in the reform. We're hearing that commissioning experience varies when delivered by different directorates or different parts of different directorates. These then are the things that we now need to focus on doing something about, because it's important that trust in the process builds. I know that it's really hard to trust when in the midst of a competitive process, and perhaps that is what we're seeing in some of this data. We need to stay vigilant about building trust across the delivery phase and be able to monitor whether the new service systems that we designed together through the commissioning processes are working for the people who access those services. I also reflect that staying committed to commissioning, going the distance, is really the only way for us to know whether it's possible for government and the NGO sector to relate in new ways, to be more collaborative, to share decision-making, and to reform the human service system together. For me, there's a, if not commissioning, then what element to the work that we need to do. And that the reasons we embarked on this journey back when we did in 2019, 2020, are still really valid reasons for us to continue on this journey. So as authors, we've heard some really clear themes through all of this data from both the post-activity surveys and the annual survey, and we've triangulated and confirmed that through our informal and other sources of intelligence. So the ideal of the principles of commissioning versus the practice of commissioning, the different experiences that people have, is one of the themes that we've heard. There have been different experiences in the different subsectors and across directorates. We have heard the importance of allowing enough time across various commissioning processes to ensure high quality engagement. The process is as important as the outcome. The second theme is that our relationships are being tested through collaboration. We know that where peak bodies have been involved, there have been better processes, but not all subsectors have a peak body. So we need to do further work together to work out how we can support these sectors better. The third theme is about transparency and communication, and we know that these have not been good in many instances. There have been some delayed timeframes. There have been periods of radio silence. It feels like opaque government processes have been going on, and we know that we need to do better. And finally, we know the last theme is about how much effort and time organisations have had to put in, and that effort and time has been unfunded. Certainly, the Minister for Community Services has heard that feedback from sector leaders too. We need to be able to see that the time and effort has been worthwhile, and it will really only be during the delivery phase that that will become apparent. So there are multiple challenges. There's systemic challenges, sector sustainability challenges, the change in demand, and sometimes it can be difficult to address all of these inside the same funding envelopes. All of these challenges amid the ongoing frustration of underfunding, of contract uncertainty, is leading to continued workforce challenges, and we heard that through your feedback. Commissioning is one of the ways that you can convey this to government, and it is important that we are continuing to listen to that from you.
Thanks, Fiona. So the key question, what are we going to do with what we've heard? We need to anticipate the capability that's needed for the next wave and future waves of commissioning activity, including effective partnerships for delivery. We need to move towards a more integrated commissioning approach so that we can streamline some of our activity, and which will subsequently reduce the engagement burden on the sector. This will ultimately reduce the siloing and fragmentation of service delivery as well. We also need to demonstrate how we're using the evidence that we identify through commissioning to inform government as it decides its investment priorities through the territory budget. I might throw to you at this point, Devon.
I think not me.
No, okay, we'll just edit that bit out. So let's turn now to the actions that we need to take to drive improvement for commissioning practice and commissioning experience. So we've identified 4 priority actions in the report. We know that the process of commissioning is as important as the outcomes. So we need to build capacity to engage in the process across both government and the directorates and the sector. This includes sustaining a focus on acting in accordance with the principles of commissioning that I'm sure you will all recall we developed together back in 2021. Each year, we've been transparent about the improvement actions that we're proposing or that are underway, and you can find detail of these in the full written report. In this listening report and in the summary, you can see that we've named some focus areas and the new actions and the ongoing actions. Critically, there are things that we can do right away to set up the next commissioning cycles well, and that is why we're focusing on priorities 1 and 2, about how directorates and the peaks work more closely together to identify issues and data needs and lessons learned, and how we continue to design well the engagement approaches that we're using in commissioning and how we can integrate across multiple programs. At the same time, we need to get involved and use the Sector Sustainability Project as one of the things that will inform the new investment where we have evidence for it. So that's why it's listed as Priority Action 3. As commissioning matures, we need to bring other government processes with us, like the ACT budget. How can we use the evidence that we've developed together to inform investment decisions of the future? And we are almost at the midpoint of the reform, so we need to re-look at how we are evaluating commissioning. So far, the focus has been on the experience or the practice of commissioning, and maybe it's time we think about shifting that focus towards the outcomes and the impacts of commissioning so we can evidence how all of our collective efforts are supporting the health and well-being of Canberrans. And that's why we've put that as Priority Action 4. Devon, you've got some thoughts on these priority actions?
Yeah, thank you. We're really conscious of the challenges of working in a chronically underfunded sector, and that means both at the level of having capacity within the community sector to fully engage with commissioning processes so that the expertise that the community sector can bring to bear is considered in the way that it should be. And also what it means to be undertaking a commissioning process when in most cases the funding envelope for a sector is considered to be inflexible. And where there are cases where it's clear that demand for services exceeds what can be met within that funding envelope, that quite understandably leads to frustration. There is an opportunity to use existing budget processes to integrate the information that is generated in commissioning into decision-making in government about funding. And much of the success or otherwise of commissioning is going to depend on how well that happens in the medium term. The sector sustainability project is absolutely a good start. We note that the timing in terms of where many subsectors are up to in terms of commissioning and procurement and how that aligns with the timing of the sector sustainability project is not ideal. But the sector sustainability project is a good start. One thing that we need to be careful of, though, is to ensure that the sector sustainability project is used to positively enhance the commissioning process, and that we don't get a dynamic where the commissioning process relies on the sector sustainability project to bring funding up to more sustainable levels, and the sector sustainability project relies on commissioning processes. Over to you.
Thanks, Devon. So let's turn our minds now to how we can contribute to implementing improvements. We know that collaboration fatigue is real. We value deep collaboration, but we recognise that it does come at a cost. We continue to welcome your involvement, and we will strive to keep you informed. There are ways that you can be involved and to stay informed as we push ahead with commissioning reform. So, for example, whether you're in government or in the sector, you can participate in the conversation by commenting on draft policies. You can engage in the process more fully, and please always keep using the formal feedback mechanisms that exist so that we can keep learning and improving on commissioning. The formal feedback is a key input to the listening report, and hearing that feedback does really make a difference to the process. Devon, do you have anything to add on that?
Yeah, thank you. So from ACTCOSS's perspective, we will continue to listen to the sector as another mechanism of informal feedback, while still encouraging participation in formal feedback mechanisms. We also play a role in helping the whole system learn. And one of the great challenges, I think, for everyone is that commissioning is being rolled out across multiple areas of multiple directorates. And ACTCOSS has a unique position to be able to see how this happens from the community sector's perspective across a wide range of areas. And one of the keys to success of commissioning will be how rapidly we can learn from the mistakes that are inevitable at the start of a reform this deep and broad. And so we'll continue to work with our colleagues in government to try to help the whole system learn the early lessons from commissioning and as we go on through the midterm lessons of commissioning. Ultimately, and I think it's important that we remember this, the goal of commissioning is to improve outcomes for people experiencing poverty and other forms of disadvantage. Done well, commissioning will achieve this aim. Done poorly, it could have the opposite effect. And so the challenge is to collaboratively, government and community sector, learn quickly enough and act on those learnings quickly enough to make commissioning beneficial for the people who we are all doing this for.
Thanks, Devon. And that brings us to the end of this overview and summary of the listening report for 2023-24. We hope you found it useful to have this taster of what's in the listening report. Encourage you to go to the document itself if you'd like more detail. And thank you very, very much for your time in listening with us today. Thank you also, Jamie and Devon, for your participation in this process with us. Thanks, everybody. All right, that's enough of a pause for Kath to be able to cut the recording at that point. How are we feeling?
I'm all right with it as long as I wasn't too verbose.
Yeah, look, I'm thinking that it's probably good enough. We don't need to go through it a second time.
Yeah.
There were a couple of pauses that are easy to cut out.
Yeah.
Yeah.
Sorry about those. It's again because
Easy.
I was looking at two different windows and yeah, wasn't watching the changes. And sorry for that fake throw to you, Devon. I mean, come on, couldn't you think on your feet and just make something up? The version I'm looking at had that you were going to say something here, but yes, sorry, it's obviously an older
no
version.
worries. No
My bad.
worries. Yeah, sounds good.
Awesome.
Fiona, I'll just let you know that my surname is pronounced Bowles, which is less a problem for me than for my father, Phil. My mother retained her surname, and my dad definitely did not wear the pants in that relationship. But in one